Supplies I am going to use for this task are rubbing alcohol that is going to be used to clean the area before directing the needle in. I do have a 6cc syringe that is the size we use for our cystocentesis. And then I do have a size, it's a 22 gauge needle, but it is a 1.5 inch needle just because this is a kind of a bigger dog than, like she's a little overweight, so there is a lot more cushion there to get to the bladder. I do have a backup needle size as far as it is a 22 gauge needle as well, but it is 3/4 of an inch. So those are the supplies I am going to use during the cystocentesis. The cystocentesis I am doing on the female dog. This dog does weigh 20 pounds, and so I will be doing a 22 gauge needle just because we do find that does work better for the dogs, and kind of a smaller needle to should just let it be somewhat more comfortable for them.
Oh, right.
Okay, so first thing I'm going to do is palpate the bladder, which it is right there, very big bladder. Going to run some alcohol over this, and we do our cystos via ultrasounds. And I am collecting urine. And I'm going to make sure there's not any extra air in there as I take it out, but I do not withdraw any blood. So as far as while doing that female dog cystocentesis, whenever I stuck the needle into the bladder, and I immediately was into the bladder, which is great, so I just drew out urine. Now as far as whenever taking that syringe and needle out of the abdomen, I make sure that there is not any pressure into the plunger to where it is going to maybe suck up like outside of her body, outside of the bladder, like blood, things like that. Do not want to damage anything while doing the cystocentesis. Things that could happen, like as far as, let's say, if I didn't directly get my needle into the bladder. One thing I'm going to do is, let's say I try it, I'm not in the bladder, I need to try again. I'm going to pull that needle out without the plunger being like where the vacutainer is, the vacuum seal is going to be pronounced in that. So I'm going to pull that out, I'm going to reapply a brand new needle, and then I'm going to attempt to do it again. Now, as far as one reason we always try a brand new needle on is you want as little blood as you can possibly get, because you want that urine to show up accurately. It's going to create blood in there if we are constantly pulling that needle out, put it directly back in to try again. Also, you can damage the bladder with that, so we do not want to keep trying to do that. We want to keep everything as healthy as possible for that animal. We want the urine to come out as normal as possible. We don't want any abnormalities on it. We don't want it to be contaminated in any way. We don't want extra blood that doesn't need to be there. And as far as with a urine, what I'm going to do is this urine I'm going to put into this plain red top tube. I'm going to put it in there. I am allowing the vacuum seal to fill up this red top tube. I'm not applying any pressure on top of the plunger there. I'm just allowing it to fill up. And I'll allow it to fill until it stops. And there it stopped. So now I'm going to pull that out. I have my red top tube here, and I'm going to put the name of the dog on here. I'm going to put the date. And then as far as if I were not going to run this urine right away, I would put it in the refrigerator. Anything in over 30 minutes, it needs to be put into the refrigerator and done at a later time or whatever the doctor has ordered for the testing to be done.